Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. I'm an attorney, a dentist, and a practice cell broker. This podcast is my brainchild to help inspire, motivate, and educate dentists to create the practices and lives they want. I've personally owned 3 practices and worked with thousands of dentists in my capacity as their broker or attorney. I want to put my expertise to work for you and help you find the success you want. After all, you're my peeps. Let's get going. Sexual harassment is a big issue these days. Sexual harassment is all over the news with the Me Too movement and now a new law that was passed on January 1st, 2019 that requires all California employers with 5 or more employees to provide sexual harassment training starting January 1st, 2020. This includes full and part-time employees. Note that in order to meet this January 1st, 2020 deadline, all employees must be trained in 2019, as in now. 1 hour of training is required for non-supervisory employees, and 2 hours of training is required for supervisory employees. Also, this training is not a one-time thing. It's required every 2 years, just as is the Dental Practice Act course and the Infection Control course. So add it to your list of things that have to be done. Sexual harassment pretty much has always been going on, but for the first time now, it is really being talked about in a big way. The pendulum has certainly swung. Let's go over the basics of the law. First, sexual harassment is prohibited by both federal and state law. And what that means to you is that if you do it and have a problem with it, you can get the book thrown at you every which way, and sexual harassment judgments are among the largest out there. Very rarely do doctors have sufficient insurance to cover everything if they have insurance at all. The 2 main types of harassment are quid pro quo harassment and hostile work environment harassment. Quid pro quo literally means this for that, such as I'll look favorably on you for a raise or a bonus if you do this for me. I mean, a lot of the movie stars are talking about that. They get the role because of whatever. And of course, there are many, many versions of this kind of harassment. Hostile work environment means a work environment that's generally sexual and hostile. As an example, one of my first jobs out of school had a separate restroom for doctors than for patients and staff. One day when I was in the restroom, I noticed the wallpaper was literally pornographic. People were having sex in all kinds of contorted positions all over the wallpaper. I was shocked when I noticed it, but I just wanted to keep my job, and I said nothing. And remember, sexual harassment doesn't have to be sexual at all. It can include showing hostile treatment towards someone based on gender, based on their sexual preference, that kind of thing. So that is, sexual harassing conduct does not have to be motivated at all by sexual desire. And don't think the sexual harassment has to be only during work hours. If an employee sees sexual posts about them on social media or receives sexual texts from doctors after hours, this is also sexual harassment. I think it's relatively common for sexual harassment to take place in a dental office. After all, it is still often male doctors working with a staff of all females. And too much of a familiarity can and does develop when the doctor can take liberties that are clearly inappropriate. Now, even though sexual harassment isn't always male to female, most of the time it is. However, in a dental office with a staff of all women, if a male is hired, the women can often harass the male. I had that in my own dental office, and the poor guy quit after a few months. He couldn't stand being pinched, teased, and touched any longer. Fortunately, I didn't have any repercussions for my employees' actions, but nowadays that certainly could have led to a constructive discharge claim, meaning that the employee can no longer tolerate the working environment and has to quit, which is the basis for a wrongful termination lawsuit against the employer. I don't know why so many male dentists often think the office is their kingdom and they can do whatever they want, but it's a pretty common thought. It's like no law applies to them, whether that law is about sterilization requirements or about making sexual comments and touches to employees. I mean, we're no longer in the dark ages, and that stuff is just not okay. In what I do, I've seen all kinds of weird things, like doctors that give patients porn to read while waiting. Clearly hostile work environment. Doctors that have sex toys and porn and alcohol in their office. I've seen that many, many times. Nowadays, this certainly could be interpreted as a hostile work environment. And also remember, sexual harassment can be a two-edged sword, even if you didn't get sued for it. In many cases, the employee has a hammer over your head for the rest of your practice ownership life. I see this too often with practice sales. For example, I'll see a huge expense in the auto category. And when I ask the doctor about it, they admit to making payments on a car for an employee. When I ask them why, it all comes out. Sometimes it starts with, well, 20 years ago, I made a mistake. And now I can't fire them, even though they've barely worked since. Or I see a doctor paying for something quite expensive for a single employee. In those situations, it's almost always due to some kind of sexual relationship between the doctor and that employee. And not only is that extremely dangerous from a lawsuit standpoint, that employee can also basically not be fired. I could go on and on with stories about what I've seen in dental offices, and there are dental board cases galore on this issue. But the bottom line is, just don't. Go somewhere else. There's that old Chinese saying, don't put your insert body part in the cash register. And it's good advice. Thank you for listening to the Dentistry Rising podcast, Dr. Betty Robin. Please subscribe on iTunes so we can get better and better at helping you make your practice dreams come true.